Hey, San Diego, it's Dr. Jason Shumard with Integrative Wellness Center of San Diego. And I wanted to do a quick video for you guys here to discuss a very important topic, something that I get quite often in the office from many patients, and that is, how is it that I still have diabetic complications even though my blood sugars are good? Meaning their doctors told them that their blood sugars are good, or they're seeing that their blood sugars are testing every single day are in a good range. And so it can be very frustrating. So maybe the doctor is happy they're not raising their medication at all at this time, but they're having complications. They're getting the neuropathies. They're starting to have some visual issues. Maybe they're starting to have some cardiovascular problems, or their kidneys are starting to get bad. They're starting to have some digestive issues, like maybe acid reflux or GERD, or some kind of discomfort in their stomach, or other types of things that are associated with this disease process. And what's frustrating for them is that as this continues over time, there's really no answers, because the doctor is saying, hey, everything looks great, keep up the good work, and they're doing fine, even though the complications are occurring, or the only answer for the patient is, we're going to give you another medication. Maybe for the neuropathy, they're given gabapentin or some other neuropathy medication. Maybe for the acid reflux or the GERD, they're given something like omeprazole or some other antacid type recommendation. Maybe for their cardiovascular issues, they're given another blood pressure medication or a blood thinner. For their kidneys, they're given something to protect their kidneys. Or for their cholesterol, it's increasing cholesterol. Whatever it might be, it's another drug. Well, one of the things that I want to talk about today is, why is this happening? Why is it that you are currently getting additional, or you're still experiencing diabetic complications, even though the blood sugars are better? And the reason for that is that your blood sugars is not the cause of your diabetes, right? Elevated blood sugars is not the cause of your diabetes. Elevated blood sugars is a symptom of your diabetes. So this is very important, because most people believe that the elevated sugars is what's causing their diabetic condition. And if they can get that down, if they can lower that blood sugar, that they're going to get better and be able to get off the medications, and they're going to feel better as well. Well, time and time again, that plays untrue, because so many individuals, maybe someone who's watching this video right now, are still going to experiencing symptoms of their diabetes, even though their blood sugars are getting better. So again, if we were to compare this, let's just say that somebody has a cough, they have a headache, and maybe achiness. So would it make sense to treat the cough, headache, and achiness, or would it make sense to treat the cause of what's causing your cough, headache, and achiness? I.e., maybe it's an infection, maybe it's a virus, maybe it's a bacteria, whatever that might be. Doesn't it make sense to treat the virus or bacteria or the infection than it does for the symptoms alone? Of course. But right now in diabetes, you're being diagnosed with diabetic condition, and the treatment is to give you a pharmaceutical drug to lower or reduce the symptom, which is blood sugar. So your blood sugar is going up because you have a problem inside your body. At one time in your life, you were able to regulate blood sugar. You were able to eat what you wanted to eat, do what you wanted to do, live the life that you wanted to live, and you were able to regulate blood sugar. You're able to wake up, be fine, no big deal, no issues. But over time, that changed. See, it's really important that you understand, if you have diabetes right now, that didn't develop the day you were diagnosed. That didn't develop the week before you got diagnosed. That development happened years, possibly decades, before it was finally diagnosed. This is the reason why so many people, when they get diagnosed with diabetes, they have no clue they even have diabetes. They don't even know it's even going on, because a lot of the symptoms don't happen until later on. But your doctor tells you, well, you have blood sugars of 300 or 400. How are you even living right now? And they're saying, I feel fine, because the symptoms will oftentimes happen later. So the treatment at that time is to give you a medication like metformin or some other type of medication to help you lower the blood sugars. And guess what? That medication will do it. It'll help you lower the blood sugars. Maybe it can help you with some of the symptoms you're experiencing at that time as well, because if you are having symptoms, the elevated blood sugars could be the contributing factor. But over time, not only do your blood sugars worsen over time with this disease, as we know, but the increase in medication happens as well. And on top of that, the development of complications continue to occur also. So what we have to understand is if we have to move away from thinking that treating the symptom, which is blood sugar, to treating the cause. Now, there could be multiple causes of why your body's not functioning properly and creating this diabetic condition. That has to be investigated. But unless you look for the cause, you won't be able to treat the cause, which means you won't be able to get better and reverse the diabetic condition. So why is it that in a current healthcare and your traditional medical care, they're not looking for the cause? They're not even testing you for the cause. In essence, they really don't even care what the cause is. It's because they have pharmaceutical drugs to manage your disease. See, the difference between what I do in my practice, which is referred to as functional medicine, which is where we're looking to see where that person has lost function, what has broken down inside their body, causing their symptoms, causing their disease process. In the traditional medical model, they're not going to look for the cause. They're going to look to see what can we give you pharmaceutically to help you feel better, to help reduce your symptoms, i.e. elevated blood sugars, lowering blood sugars with a blood sugar medication. Elevated cholesterol, give you a cholesterol lowering medication. Elevated blood pressure, a blood pressure medication. Neuropathy, give you a medication to lower the symptoms of the neuropathy. But if you stop that medication, if you stop the blood sugar medication today, what would happen to your blood sugars? They would go up. If you stop the cholesterol medication, what would happen? The cholesterol would go up. The blood pressure medication, the blood pressure would go up, and on and on and on. So essentially, the medication is there to manage your symptoms or manage the disease process. It's not there to help you fix the problem. In a functional medicine model, our goal is to analyze to find out what is causing your issues. What is causing the symptoms? What is causing the disease process? Once we analyze that and understand what that is, it's very simple and easy to put together the proper steps to help your body heal. You have the ability to heal. You have the God-given right to heal, but if you're dealing with this type of condition, your body is just in a state right now that it can't heal. It's in a poor environment. And when it's in a poor environment, it can't heal, it can't function, and it will never get better. It'll only maybe feel better for a period of time, but things will progress over time and they'll get worse over time. So you can sit and wait for the symptoms to progress and get worse with time, or you can take action immediately to find out what is causing your diabetes. What has happened inside your body? And I can tell you right now that the cause of your diabetes is not your diet, it's not your weight, and it's not the lack of exercise. Now, those three things, diet, weight, and exercise, will definitely help you lower blood sugars. For sure. 100%. I will go to bat for you on that. That'll help you lower blood sugars. Now, if your goal is to only lower blood sugars, there's your option. Take your pharmaceutical drugs, exercise, lose weight, and try to have a good diet. Those things right there will help you lower your blood sugars, and you're going to continue to manage your condition and potentially slow down the process if you're lucky. But if your goal is to reverse it, to find out what's causing your diabetes and reverse it, those three things will not help you reverse it. Because maybe those three things contributed to problems in your body and started to cause things to break down inside your body. By removing them, whatever broke down inside your body will still be there. It will not fix itself on its own. So you not only have to change your lifestyle, but you have to understand what needs to be fixed inside the system, what needs to be restored to help you get back into that proper, healthy environment so you can continue healing and doing things you want to do, to continually have a good quality of life, to have a healthy life, and to live a better quality of life throughout the rest of your years and reduce the risks of complications, reduce the risk of an early death. We know that diabetes will decrease your lifespan by a minimum of 10 years. So you have the choice. but you have to take the action steps. You have to seek out the practitioner. You have to let them know that you are ready to make the choices. You have to do what needs to be done. You have to put your health as a priority and let them know, I'm ready. Because if you're not ready to make the choice and take the leap, if you will, to get better, no matter what you do, you will not get better. Now, you could sit there and help yourself and exercise so the cows come home, reduce your calories, eat a good diet, and you're going to lower blood sugars. And you may slow down the progression, but over time, eventually things are going to get worse. And you're going to eventually get to a place where you're going to want to get help. And hopefully, it will not be too late. I have seen too many people who have waited because they were basically thinking and hoping and praying the symptoms would not get worse and they would still have hope there and get better. And now they're seeking me out looking for help and saying, and I'm telling them, there's nothing I can do. I wish you would have come to see me 5 years ago, 10 years ago. So if that's your situation right now, maybe it's not me, maybe it's another healthcare practitioner who does this type of work, but please reach out to them, ask for help, use their expertise, and they can help you guide yourself back to health again. You have the ability to do this. You don't have to wait for the complications. You don't have to wait until you lose a foot, a leg, or when your kidneys are failing, or you had your second heart attack, or you already had a stroke, or things are just breaking down and you have no motivation, you have no energy to go do anything, you can't walk more than like maybe 20, 30 steps before you run out of shortness of breath, or your feet hurt so bad. Don't wait for that to happen. Make the choice now.